A major opportunity that is emerging for some that are keen on doing business is one that involves provision of social services. Now, there are those that have gone into education, while others have gone into health service provision. So today, we want to know what it means to occupy this unique position as an entrepreneur, but also a provider of social services. Take a look.
We are almost making 10 years of service. We started in 2015 in 2 rooms which we were renting, and after like a month we were told to vacate. We got some simple building which we renovated, but the space was not enough. We used to admit patients under the bed. However, during that period they were doing the Chisoga Katosi Road project. We got the waste soil and money to make bricks and set off the foundation. Today we have 50 hospital beds, and we're a 50-bed capacity hospital with a theater, with a lab, a dental clinic, radiology department, a very good eye clinic, and so on. So like our motto, we serve the community regardless. The people we serve get less than $3 a day, and these are farmers who do subsistence farming. They get less, but we always try our best to serve them with the little they have. Every year we deliver between 400 to 600 mothers. That is as per the report from Ministry of Health, because we report through the DHIS2 reporting system. And we do around 250 cesarean sections. But you find that our Caesar is deliveries, mothers pay like $5, but still some run away without paying, so they have nothing at all. Because our community is basically made up of people who, unless many have non-communicable diseases, they have diabetes that's not treated, they have ulcers, they have a number of illnesses that are painless, but usually these kill many. So we last did the camp in 2020 because of COVID-19. It really made a big impact on our service. We couldn't offer anything. So we are trying to wake up from the COVID strain and pandemic. So we decided to make this camp to reach out to people, the elderly, the children, to give them at least some hope of life. And we've got so many partners who have helped us. One Project Foundation, we've worked with Lions Club Mokono, we've worked with IME 2000. Many have helped us and the staffs. We've reached out to over 2,000 patients in these 2 days. And we've topped up that day by doing 20 cataract surgeries, which are free. You can't imagine a patient walking into the hospital with diseases that are not known and getting diagnosed, getting treatment, and walking out. Today, drugs are very expensive. There are so many taxes. So it's a great impact to the community, because many came with ulcers, many came with hypertension, many have diabetes, but they have got medicine. We always want to have medical camps, but we don't have support. Otherwise, we would have, like every quarter, we would have medical camps, because a number of our people do not have the money and access to medicines. And sometimes you find there are government facilities, but of course drugs are not easy. Even in government, it's hard to stock hospitals. The biggest challenges we face is we run a budget of $40,000 to equip the pharmacy. So it's very hard to buy drugs, to pay the staff salaries, and also the community perception. Some people were like, we need to use the herbalists to treat our ulcers, we need to smoke the pipes. Maybe the region doesn't want us to go to have a blood transfusion. So sometimes we have the negative perception of people. If you test someone HIV and it's like, I'll take my herbs. We would like partners that if they can help us with staff infrastructure, we are trying to make a project where we have a plan of building staff houses, staff quarters. We need to complete the phase 4 of the hospital, which would have the theater, the intensive care unit. When the students who got burnt were brought at the hospital, we had no ICU, so we couldn't accommodate them and refer them in town. There was jam, so we hope to at least have the ICU so that in case such tragedy happens again, we're able to save lives. That time we lost over 12 children in the fire. So we want to have a better ICU, a better theater. We need to have staff sleeping well, at least near the hospital, and also getting a better pay.
This is a general medical camp that we always do every year, and it is basically made to see that we give back to the community, because we live in a community where people are very poor, so some of the services here people cannot manage. So what we do every year, we arrange something of this kind so that we can give back to the community. And all the services that we give range from the lab tests, the consultation, everything is free. Besides the general medical camps that we organize, we also offer free services like immunization of babies. It is free. And we also conduct what we call outreaches. In outreaches, we move to villages using the ambulances that we have and give free services to the people, free HIV testing and counseling, free drugs, free eye checkups, and free treatment to the old and the less privileged, like the lame and also other people. We normally do this when we go to churches, mosques, and also areas around Lake region, like Katosi, Senyi, and the rest.
Patience and resilience are critical ingredients for anyone who wants to do business, and more so, those that want to sit within the agribusiness space. Today, we want to find out what it takes to build that resilience to play in the business space.
So platforms like this, focusing mainly on the youth, are important. Why? We have youth in the sector that don't have money, that don't have funding, that don't have, access to markets, that they even don't know where to start from. But yet they have parents, they have guardians that have land, that have everything, that are even in agriculture, but they could tap on that. So that is why we call upon the Ministry of Agriculture, Ministry of Gender and Labour to support the youth where it is necessary. Let them give them funding, but also give them the support they need to make sure that that funding doesn't go to waste. Now, most of the people think that farming is for older people, that once you go into farming, it won't be your lifestyle. Look at me. I have my painted nails, I don't look bad for young people, yet I'm in the agriculture sector. The agriculture sector does not take away your lifestyle. The agriculture sector does not need you to sit in circles and then you be shy to talk about your company. So as young people, be proud of what you do, but most importantly, you must be resilient, you must be patient, because it's not a simple journey. It's tough, but I can tell you're going to earn money. Now, when it comes to market access, this is what I can tell you. Start small. Start small. If you start small, you will have market for that small project that you have started with. But if you start big, then it will be bigger markets. But in agriculture, you can start with, 1 ton, or even a quarter ton, whatever you produce. Go around the village, or even your families. In agriculture sector, it's a sector where even your family needs food. Your friends need food. Every day, your family or your family's friend or your sister's friend, they need tomatoes, they need let's look at matoke, they need cassava, they need what? Now start supplying your families. Use your families, and to the parents outside there, to the relatives outside there. Why would you rush to the market, yet you know that your nephew, your niece is in agriculture? Support those ones. But to the government of Uganda and to the president of Uganda is that it is very, very important that once you come to attend business events for young people, you sit and listen to them. It's not all about you telling us what you want us to hear, but you also listen to what we have for you. So to the government, to the ministers, to the MPs, to the chief guests, when you go for a youth event, give them time, listen to them, other than reading a speech and then you rush away. Because even them, they feel like they want to talk to you, they want you to listen to them, and it empowers them that, you know what, I went to this exhibition and the minister was there when I was performing or when I was presenting. So it is important that you not only empower youth by creating these events, but you empower them by giving them an ear, by giving them your attention.
A number of successful and sustainable businesses are those that meet the needs of society or those that solve the problems of society. Now, innovators today saw the need for information as one of the ways they can actually make money and do business. They are aggregating different media houses or newspapers for that matter and then giving them to you to read.
So what we saw, this was 7 years back, it was quite interesting. We missed a tender, you know. We missed a tender, and unfortunately the paper that had the tender was already finished in the market. So we ran to the publishing house. By the time we reached there, we realized that the time we reached there, we got the physical paper, the time of the tender was already expired. So we missed that tender. And coming from a background of marketing agency, we say if this is a problem that we have encountered, there's a big possibility other companies and people that love to read about what's going on and curious minds might be facing in terms of having access of quality publications and journalism from local publishers. So we went on and said, why don't we build an app and aggregate all local newspapers on the app? I remember when we went to the publishing house, this was 7 years ago. They were like, well, what are you guys talking about? And we told them this is the future, right? And in the process as well, we managed to convince, in Africa, all you take is to convince one publisher. So when one publisher came on board, we were like, you see, this publisher is on board, so they see an opportunity. So fast forward, we went and built a solution. At that time, it was called AIM Paper. We were driven by the way the mobile money had managed to change the mindset of consumers exchanging money, digitally. We said, why don't we leverage on this wave and build a mobile paper? So it was called AIM Paper back in the day. So the solution was simply aggregating local newspapers and delivering it to the end consumer. So it can be a corporate, it can be a researcher, it can be students, they can access it on the mobile app. As days goes by, we evolved. And interesting thing, we saw the rise of our solution during COVID. Because unfortunately, part of synthesizing the COVID matter, paper was one of the things that was driving COVID to explode more. So we saw there was a huge dip in revenues and also advertising spend as well. So also social media looked like a thing at that time because advertisers saw return on investment. But for us, we saw an opportunity because we were obsessed and our numbers started spiking. So we saw an increase of 60%, right? So our first 4 years were not rosy. We were trying to build a momentum and build case for the consumers that they can also access newspapers digitally. It's not an article, it's a full paper. The difference is that you can get it on your mobile app. So all the key things that we managed to do, now we are aggregating beyond newspapers. So we're also aggregating audio, which is podcasting. We're also aggregating radio shows. So for example, there is there are certain shows that have been sponsored by an advertiser, right? But again, what makes you not see that this same radio show that I did today, the morning show, why can't I also look for another aggregator platform to be able to push and get the numbers, and also look for advertisers to be able to also advertise in that? So we've also seen that there's great potential in podcasting and aggregating radio shows and TV shows in audio format, because we've also seen that consumers are more into listening and viewing. So we're trying as much as possible to be able to deliver that, but through African context.
Well, that's all we had for you on this week's edition of Money and Market. Thank you for being part of the show. I've been your host, Charles Borge. Now, from me and Tim, we'd like to wish you a very good evening. But like we always say, businesses are going concern. So let's keep the conversation going. We have these and more stories on our digital channels and platforms. Let's have a discussion there. Until next time, once again, good evening and God bless.